Hello, I'm Robert, and this is the second half of that video helping people who are scared of COVID-19, and I'm going to talk about how we can suppress it and bring this disease right down. And South Korea reduced their cases per day tenfold in a fortnight, and it goes up and then it goes down at the same speed. Now the situation in the UK, we are really probably a very bad way at the moment. So where's that? That's the situation in Nigeria, sorry, from the United Kingdom. That is actually relevant to what I'm going to talk about, but I've got to bring up the United Kingdom one for this little bit. So, United Kingdom, then if you go and look at our figures, then it was about 500. I'll use myself to my image to get to kind of place markers. So confirmed cases in total, then was it about 500? That was when we moved to the delay phase. See, it's gone up and up and up, and now we're up to 41,000, and had 3,000 the last day, 4,000 the day before. Now these are mainly hospitalized cases, because we're doing almost no testing of the mild cases. This means that roughly 5 times that amount, so about 20,000 a day, are getting infected, are getting the symptoms that are not being tested, and the total is probably well over 100,000, probably over 150,000 that we've got infected in the United Kingdom. Still, we can reduce this right down, and we have a duty not just for the other people. So you could say, and then the other thing is, there's always a delay. These people who are being diagnosed now, those 40,000, they are only diagnosed once they're in hospital, which is usually into the second week of infection, and then the second week of infection, there's also an up to 14 days incubation period before then. So people who got infected today, some of them will not show up in those figures until 3 weeks from now. And on average, they're going to be a week or two from now. So if you look at the people who are already infected, and given that these numbers are continuing every day, then it's likely we're already well over that number already infected. So well over 150,000 already infected. It's impossible to guess how many. We probably have several 100,000 that are already infected that we can't do anything about now, because there's no way to reverse it once it's infected. So what we have to do is to say we are at, say, 300,000 now that are already infected, just to take an example. Then, using this method that I'm going to explain, we can reduce that tenfold in a fortnight, every fortnight. So, no, we can't reduce we can reduce the numbers infecting. So, sorry, I'm getting this mixed up. We would have 4,000, we've got about 20,000 cases a day being infected. Suppose we had, say, 300,000 that already infected, and we're getting another 20,000 a day. Then we're like that, but we're starting at 20,000 instead of 1,000. Then, after a fortnight down here, we will be down to 2,000. Then another fortnight, we'll be down to 200. And then we're getting close to what Korea achieved with 2 weeks. So if we started right now, we could get down to 200 in a fortnight, in a month. We could get down to 2 in another month, and then we'd be just about gone over it. Those are the new cases per day. And the total, well, you can see it's roughly the same area on this side and that side. If we are bearing in mind you've got the external ones coming in from outside South Korea as well, it would probably be almost symmetrical in terms of area. So from our 300,000, if we've got 300,000 infected today, we could end up with stopping at 600,000. And out of a population of 66 million, then you're saving millions and millions of people, tens of millions of people from getting it. If we were to start this suppression today. And every minute matters. The Italians sent pleading letters at the beginning of their outbreak to the rest of Europe saying, do this now, do what South Korea did. It works, it's the only way ahead. This was just, again, days before the United Kingdom moved to the delay phase. They sent letters, an open letter to all the scientists in Europe saying, try and persuade your government to act quickly and do what we should have done 10 days before we did it. Because the sooner you do it, then the less high your peak goes, the quicker you stop it. Because it's roughly symmetrical. So, and this is similar, Wuhan city, similar idea. It stopped there, so these are the symptoms, the infections would be there, and the infections would go down, see that's well under tenfold in a fortnight, it's a similar scale. Infections per day. And you don't need to find everyone. So this is something that people get a bit confused about. So suppose you had 100 cases, and then they would normally infect 200, then 400, then 800, and now you've got a total of 1,500, with that happening every 2 weeks. We've been increasing tenfold roughly every 2 weeks in the UK. Then if you can cut 3/4 of the infections, then the 100 infect 50, then 25, and so on, and you can finish a total of 200 cases instead of our total of 600,000 or whatever it is if we were to do it now. But if we find 3/4 of the transmissions now, then we can still stop it at just maybe double the amount we've got already. So those are the new cases I'm talking about there. And yeah, anyway, I won't go into too many details. So how is it that we do this? So it's all to do with the infectiousness period of COVID-19. In fact, I think I might have an article up about that, so I can just pop that up. No, I haven't. Yes, here we are, isolation period. So I'll just bring that up. It's second in the list there at the moment. So the WHO advice is to isolate for 2 weeks after symptoms disappear and to do all this contact tracing. Why? The reason is because this is about the infected before. So if you got the symptoms there, this is about the infector and infectee. Then if this is day 0 for the infector, and this is the day at which the infectee had onset of symptoms, and some people have symptoms 10 days before the person they infected. So what that means is that you were infectious 10 days before you got your symptoms. At least that, because they got it from you, and they got their symptoms 10 days before you did. So you must be infectious for those 10 days. And so most is just a few days, because suddenly you get 12.6% actually develop symptoms before the person that infected them in this big study of getting over 500 people. So this is why it's so important to do the contact tracing. And then you can, this diagram doesn't actually prove that, the next bit, but they have viral shedding continues for viral shedding. Then the virus was, for SARS, it was infectious for up to 3 weeks, and then you got the but you had live virus couldn't be detected after 3 weeks, after week 3. For this, then they just don't know. You have virus shedding all the way through to death, or through to up to 2 weeks after you recover. So this is a disease that it is really rather hard to get. People living in the same household, you often get these stories about the husband and wife, and one of them, or partners, and one of them has it, the other doesn't. And people all go act astonished and say, how is this possible? You get this over and over again, because they're used to flu. But this is not flu. And it is an upper respiratory disease. It's a lower respiratory tract disease. It doesn't like your nose and mouth and eyes. That's the only way it can get into your body, but it doesn't like it up there. And it's really quite difficult to get it. And it might need quite a high viral load or for a long period of time. People only seem to get it, mainly seem to get it through very close contact with exchange of bodily fluids or with very prolonged contact. And so this is why that it's just not it's transmitted on your saliva basically, and on the on the droplets that come out of your mouth when you're talking. But even then, it takes an awful lot of that for most people before they actually get it. But some people get it more easily. And so this is why it is so important to quarantine and to put quarantine to isolate for a long period of time. So the British isolation period is through to death for those who die, through to 14 days after recovery, or 2 negative PCR tests 24 hours apart. They recommend this. If not that, if you can't do the PCR tests, then wait till you recover and then an extra 2 weeks. The UK's isolation period is for 7 days, and for instance Matt Hancock has just come out of isolation after 7 days because he had a mild version. He thinks he's not infectious. He's not getting the right advice. So this is why it's so important to do these contact tracing. So to explain how the contact tracing works, then so you've been infected. Let's go back to that one. You've been infected here. No, you had your symptoms here, and you go in and you get tested, and you probably get tested sometime around here. And then they will go back and say, oh, well, you say, oh, I had lunch with this chap. And you had 10 days before I was infected. I had dinner with someone. Or I was visiting my niece or my granny or something. And so they will say, okay, ring up that person, and then they've got to isolate for 2 weeks. So they may already be infectious. So they may have got it even if they got it 10 days ahead in the past, and they're not necessarily going to start symptoms till sometime around there. And if it's people a few days back, most of them would be a few days back, then they might not get it, might get symptoms till then. So you stop the person themselves as soon as they got symptoms and they realise it, and that's dealing with. So, and this diagram is not really that good, and I want to demonstrate the idea, but just to I'll go back here and start explaining with words. So you've been once you're infected, once you're diagnosed, then you're immediately isolated, and that stops all the people that would have got infected by you if you hadn't isolated. And so Matt Hancock may be out infecting other people. If he was isolated for the proper period, then all those that he might infect have also been stopped. And then you also have to go back in time to several days before your symptoms even started and look at everyone from there to the diagnosis that you've had contact with, and you go and isolate those. Now those people, and many of them won't have symptoms yet. So you are stopping them very early on, possibly before some of them you will stop before they've had a chance to infect anyone. So on average, this disease will infect maybe 2 other people. So your 100 infect 200. The idea of this isolation of the person who's got it and contact tracing and telling contact tracers to quarantine for 14 days and then isolate them too if they get it, then the reason for doing that is to try and cut as many as possible of the trains of transmission. You're not going to get them all, but you can get 75% or more. And if you get 75% of the chains of transmission that way, if the reproduction number is 2, then you will going down by tenfold every depends on the period, but it turns out in practice every 10 days, every week, every fortnight or so. It may be less. It depends on the transmission dynamics and details as to how fast you do it. But in practice, they are reducing it by tenfold every fortnight or less. So now, and I explained that, but I think I explained that. So you've got your 200, 400, 800, instead you've got 200, 150, 25, and then you back down to 0 within a certain number of fortnights. So if we are, say, at 300,000, then we could stop within 600,000 by doing it this way. Now we could go much faster than that. And I think that at the level that we're likely at now, then I believe, it's my view, that we should stop it much faster than that. Because 300,000 is not like 2,000 a day. We've probably got 40,000 a day, but we've probably got much more than that. We have 100,000 a day being infected, 50,000 a day being infected or more. Bearing in mind the lag between infecting and diagnosis. And so I think we need to do this very fast. We should do it today if we can. But what we need to do, we're building these hospitals, and we're building a hospital. We've just built this Nightingale hospital that's going to be hold 4,000 intensive care beds. That's quite a serious amount of money and a serious amount of work gone into that. We should be having a similar amount of work, a similar amount of finance into diagnostic tests. We should be building huge laboratories with hundreds of people and getting all the machines we can get, all the chemicals we can get. If we can't find the chemicals, we make them. We improvise. We find out every way possible. We need to have 1 million tests a day or more, millions of tests. We need to, if we do that, then we can test not just the very first thing we've got to do. We've got 1.2 million National Health Service workers. They are going around infecting patients and infecting people in the community. We need to immediately test all of those people as top priority if they have COVID-19, not just to find out if they've had it and they can go back to work, which is the way our government is doing it. We need to test the people who are working to see if they've got COVID-19 and if they're passing it on to their patients and to other doctors. And with an absolute certainty, Wuhan, with far fewer cases than we likely had, they had hospital infections. Was a big problem in Wuhan. In the United States, infections in a care home was a big outbreak. In Italy, then outbreaks in a clinic was one of the big things that started it. That someone went in to be treated, didn't realise he got COVID-19, and he passed on to other patients and other doctors. This, for a certainty, is happening in the United Kingdom today. We don't know how many of those outbreaks are happening in our clinics and hospitals because we don't even test for the mild disease. And Dr. Tedros made that point in a recent WHO interview, a press briefing. He said that we have to do the mild cases, not just to find the people and isolate them, we also have to do it in order to have a handle on what's happening. The only reason that South Korea knew that it had an outbreak in a hospital is because it was testing the mild cases. The United Kingdom is not testing mild cases. It has no way to know if it has an outbreak in any of its hospitals. So the very first thing we have to do is to test all the National Health Service workers, not the ones that are isolating at home, but the ones that are working. Test all of them to see if they have symptoms, and then we should test the ones that don't have symptoms yet. And you can clear out a hospital if you test absolutely every one of those 1.2 million National Health Service workers, so it should rapidly ramp up to 1 million tests a day, so that we can test them all. And I'm sure with our ingenuity we can do that. Even if it takes a week, then a week is too long, but we do it as fast as we can. If we can do it faster than that, then faster. Tests absolute top priority. The top priority is absolutely important, of course, to get all the ventilators in the hospitals, but we must not neglect the diagnostic testing. It should be right up as a top priority, along with making sure we've got enough ventilators for all the people who've already been infected. So if you do that, then there's this example of the small town of Wuhan. So we do it first. They had 3,300 in the town, about the same size as the number of patients in it, and so that would be like a medium-sized hospital, and you find all the health workers and all the patients. But we need far more than that, because we've let it go so far. We've let so many people be infected in our health service. We have to do this now, and we have to test many more than 3,300 people. So they tested, so our top priority is of course the ones showing symptoms, then the ones that aren't showing symptoms. And if they did that, then they got from 3% infected to 0.3% infected and no new cases in another 2 weeks. 3% to 0.3% infected and no new cases in 2 weeks. That was about 90 out of 3,300. So 90 to 100 or something. So we could clear out a hospital like that by testing absolutely everyone in the hospital, patients and doctors. And then it's not a tenfold reduction in cases per day, it's a tenfold reduction in the total cases. So from, if you've got a hospital with 1,000 people infected, then within 2 weeks you've only got 100. If you test absolutely everyone, at least from this example, whether they would all be like that fast, but it would certainly be very fast and much faster than just testing the people who are infected and showing symptoms and the contact tracing. So this method does not need contact tracing. This is the most superior of all. You just test everyone, whether they're contacts or not. You can do the contact tracing as well, and that'll speed it up a bit as well. So once you've found someone, you find their contacts and isolate them, you can do that as well. And that will get a few of them before the test gets them. But if you can test absolutely everyone every day, and even if you test everyone on one day, then that's going to make a huge difference in stopping loads and loads of transmission chains that form that day. This is not flu, it doesn't work like flu. And I think that we should do this. I think we should test everyone. First of all the people in the National Health Service, and then all the people in the United Kingdom. I know it's an absolute massive, big ask. But the downside of it, if we don't do that. So, but if we, the other side is you just do the contact tracing and the quarantine and the isolation and the contact tracing quarantine. You keep that up in a rigorous way for 10, 12 weeks or more as it comes down and down and down, and then you can eventually do the lockdown after, lift the lockdown after a month or so, maybe more. Or the alternative, if you can put the effort into it, is to do this very fast method. Do it now, put a huge effort into it. You bring it down much faster, and you can end the lockdown faster. And I think that will actually cost less of our economy in the end, despite the huge cost of rapidly producing millions of diagnostic tests and starting up new factories and all that work of producing those tests. That's work for someone. That's starting up the economy again. And it's also getting us ready to be able to crush any disease like this very, very quickly in the future. So my personal view, we should do that. And then I just end this article. I'll put the article in the description. These are all the differences between the UK's simulated flu and the reality. And so this, I've talked about that before many times. So I'll just leave that up for a minute to a few seconds for any of you who haven't seen it. We are being guided by these academics, as I said in the last video, and they are like people who study supersymmetry, who have almost no interest, well, they have an academic interest in experimental observations, but the very few experimental observations that will prove or disprove supersymmetry, and the disconnect between these papers and the actual reality of the experimental data is almost as much as the disconnect between supersymmetry and the real particle physics and the real cosmology of the universe. They just don't seem to be paying much attention. The virus in their model is airborne. The real world one is not. The virus in their model, a third happens in the community to random strangers. In the model, perhaps 75 to 85% happens in households, and most of the rest is through other forms of close or prolonged contact. Third transmission is through asymptomatic cases. Nearly all transmission is from cases that show noticeable symptoms at some point. There's a very small amount of asymptomatic spreading. There are asymptomatic cases, but they are not doing the spreading. And this is why, and they do not even model contact tracing in their model, because it wouldn't work for flu. So do not listen to these models. They do not apply to COVID-19. And we do not need to flatten this curve. We can crush it, absolutely crush it. And so that's another video. I'll put that. The COVID-19 can be crushed, not just flattened. So do have a look at that video there. It can be crushed, not just flattened, so I explain that. And the fact check. The virus that causes COVID-19 does not transmit like flu, and COVID-19 can be crushed, not just flattened. And that's what we can do. So I'm just putting a big plea, and please, please, please try and get attention of the decision makers in the United Kingdom and get them to realise, and then and also to ordinary people, please tell them very clearly this is not an airborne disease. As I said, the virus caused COVID-19 does not transmit like flu, except for in special medical situations. It does not transmit just through breathing out the tiny, tiny droplets, only big droplets that fall to the ground in seconds. You can only get into you either through them directly hitting your eyes, nose and mouth, or you touching the droplets after they've gone on the surface, or gone on someone else's hands and then on the surface, and then touch your eyes, nose and mouth. If you can stop both those ways of getting from them to you, then you won't get this virus. So the key is to keep a distance when they're talking, coughing and sneezing, and to wash your hand thoroughly using the special method that Dr. Tedros demonstrates. Just follow it through a few times, you'll get it by rote, and then you'll just be able to do it, and just automatically, when you come in, wash your hands thoroughly, wash anything, surface you use to get into your house, wash your hands before you touch your eyes, nose and mouth, and that can totally stop it, because it's got no way of getting into you, if you do that really, really thoroughly. So, that's that, and so I'll now upload this, get back to answering my PMs from loads and loads of scared people in the United Kingdom, and this is, but I just feel this is so important, even though I know there's maybe 100 people asking, waiting to talk to me It's just so heart-wrenching what's going on. I can't keep up with the PMs of the people who are scared of COVID-19 and and all this stuff. But I also feel that this is very, very important to try and do something about this. If you join our group, Facebook Doomsday Debunked, then please read the rules in the group description before you join the group. And that before you post there, you can read as much as you like, but before you post or comment, please read the rules. And we welcome anyone who can help these very scared people. And I would say about more than half of them, it's fear about COVID-19 at the moment. And my main message is, you can protect yourself. And then try and get your governments to act. And that it is really, really positive that we can totally crush this. This disease can be crushed. And we are getting good reports from the United States. We're seeing the United States is one of the ones that are doing all the testing. And they're doing quite a lot of isolation and quarantine. And contact tracing. And they've had problem getting their people actually complying, but they're gradually working around, and the young people in the United States are beginning to realise how important this is. And I was looking at the graph the other day, and the cases per day, a percentage increase is actually going down in the United States. And considering they're doing loads more tests, and yet they're getting somewhat less new cases found per day in percentage increase over what it was before, then it's very promising early signs for the United States. The signs from Italy and from Germany and from Spain, from Italy and Spain, they're both down to 4%, and imagine quite a lot of that is people coming in from other countries. It'd be very difficult for them to go all the way down to zero for as long as we in the United Kingdom are producing these hundreds of people that are going to be travelling out to these other places. And that is, again, one of the things I didn't explain with the herd immunity, that we are seeds for the rest of the world. And up until the UK went into its delay stage, the entire world was in solidarity and all working to suppress it. Now we have nearly all the world suppressing. Spain, Italy, Germany, Iceland, Nigeria, and we are sending these infections to these other countries. And that was why I brought up this pandemic in Nigeria. So the two of the important index cases in Nigeria, one was from Italy and one was from the United Kingdom. And and in fact, quite a few, Nigeria has stopped travel from the United Kingdom. And South Africa, it used to be that anyone in the United Kingdom could go to South Africa without a visa. In order to protect South Africa from the people in the United Kingdom, they introduced for the very first time ever the requirement of a visa to go to South Africa, and then they automatically deny the visa for anyone who applies to it. So that's how South Africa is keeping the United Kingdom out. And other countries are the same, Australia, New Zealand. I mean, we are going to be the major hotspot of COVID-19 in the entire world as these other countries contain it, and we go up to maybe 1 million people infected and even more. And how is the rest of the world going to keep 1 million infected Britons out and stop them from starting up outbreaks throughout the world? And that is going to be the big, big problem for the world, say 4 weeks from now. Maybe more than 1 million, maybe even 10 million. Who knows if the delay is not working. And the world will have this huge, huge problem of how to contain the United Kingdom. And it just won't be able to do it. Unless they literally, stop people from leaving the United Kingdom, have sort of planes and little boats and so on going around the United Kingdom, stopping people from exiting it. I mean, we are an island, but I can't see that happening. We've got to stop it ourselves. We've absolutely got to stop this. It is totally, totally unacceptable, and we can do it. We can totally do this. And we have to, we absolutely have to. And so please tell other people about this. Try to get some momentum. Get the United Kingdom to understand what it's doing. Get these theorists, and these theorists themselves, I feel very, very sorry for the theorists. I know what it's like to be caught up in the world of maths and really enjoy your pure subject. Then you think, oh, this subject's got this wonderful practical import. Now I can help the world. Now I can help the United Kingdom to deal with this outbreak, because I've been studying flu for all my life, and now I understand how to stop a disease, and I can know exactly what the United Kingdom can do to stop it. That's how these people are thinking. And they're going to have a tremendous shock when they realise that they're doing supersymmetry and the universe isn't supersymmetry, and their connection is not what they thought it was. Their flu version of supersymmetry, which is so beautiful but just doesn't fit what the United Kingdom is what the real disease is like. Anyway, so I hope this helps a few of you, and both to understand what's going on and maybe motivate and find any ideas you've got, any way you can try and get this over. We're getting some people saying this, and it's just like virus spreads, ideas spread, thoughts spread. Talk to people about this. Get them ask questions, and say to people, have you read what the WHO said? Do these theorists really have an answer to the WHO? They just say things. They don't answer. They don't look at the data. They don't answer these questions. These theorists need to answer the questions, or the United Kingdom government has to answer these questions. And I'm sure there's going to be an inquiry at the end of all this. We need them to stop now. We just don't have enough time for them to adjust their models and get to the right answer. So please, if any of you have any ideas, any connections, anyone you can talk to, try talking to experts. Try and find people especially look for experts who are experimentalists and who are interested in the actual data, rather than people who are all the way up in the head clouds. And get them to look at what the WHO is saying and check it for themselves. Anyway, so that's me. That's it, finished. So I just did my reminder. If you joined the Doomsday Debunk group, to please to look at the rules at the head of the group, because it's very important to how it functions before you post or comment.